News from local nonprofits, businesses, upcoming events, Conroe Park events, news stories, and information that matters to you with your host, Margie Taylor of Taylorized PR. For more information about being a guest, visit irlonestar.com/Conroe Culture.
Thank you for listening to Lone Star Community Radio. This program was broadcasted and recorded live from the LSCR studios in downtown Conroe, Texas. Lone Star Community Radio is supported by listeners like you. Donate and sponsor today. For more information on getting involved with Lone Star Community Radio, contact us at lscrstudios@gmail.com or visit us online at www.irlonestar.com.
Hey.
Hello, everyone. I am Margie Taylor, your host for Conroe Culture News, FM 104.5, 106.1, live streaming irlonestar.com, and we are broadcasting live at a downtown Conroe out of the City Hall Conroe Tower. You can follow us at irlonestar.com, Conroe Culture News on Facebook Live right now, and YouTube. So the guests today, we're going to be talking about medical challenges, and they seem to all work together. We have guests from MD Anderson Cancer Center, Dr. Matthew Wright. He is a medical oncologist, and Kendra Windisch, she's the program manager with MD Anderson. And in the second segment, we will be speaking with Don Walsh and a friend of his, LeAnn Mae. There's going to be a fundraiser for LeAnn Mae, who is giving her kidney in a surgical procedure for her best friend. We're going to hear all about that in the second half of today's show. The sponsors are Roger Stein Chiropractic and Team Sinisi, the Lake Conroe Realty Group. Roger Stein Chiropractic is located at 3033 West Davis by Conroe High School, and Taco Bell on Highway 105. You can't miss it. Treating everyone from infants to seniors, weekend athletes to professionals, with a focus on natural, holistic healing to achieve optimal health and relieve pain. Dr. Stacy Rogers has 3 other physicians working in her facility, and she has certifications in adjusting arms, legs, hands, feet, clinical nutrition, prenatal, and pediatric care. If you are a new patient, it's only $37 to go in and see her with full x-rays, and it is all donated back to CASA, Kids Under the Child Welfare System. The Lake Conroe Realty Group with Vinnie Sinisi serves as the best source for buying, selling, or investing in real estate. Call Vinnie because it's Sinisi name to remember. So what's happening in Conroe? Seems like there's always so much going on, but the good news is it's not raining this week yet. So let's just say that. The sun is out shining. Peyton Riley made her debut at the table at Madeley with Frank Jackson, the owner of the table at Madeley, a couple weeks ago, and he wanted to honor her, so he made a plaque, and her hands are in the concrete out there. So some of y'all may know that she was named Young Texas Artist of the Year, and she's also the youngest one they've ever had. She's only 14 years old. So she debuted her song, Mascara Doesn't Lie, and she put her hands, she did her handprints in there. So other things going on. City of Conroe youth sports are now taking registration for spring, and that involves soccer, flag football, volleyball, cheerleading. You can contact the CK Ray Recreation Center at 936-522-3900 to find out all the details. And there's also adult classes. Disc golf clinics happen the second Saturday of each month. That's a new thing. I know my son was very involved with that. And it sounds like it's not a combat sport. It sounds like something easy that most people can do if you have that skill set. So go out and find out about that. The Montgomery County History Road Rally is happening on Saturday, February 17th, and this is the 11th annual, and it's a lot of fun. This time it will be happening in the Woodlands, and it's in conjunction with the 50th anniversary of the Woodlands. So the first 150 registered participants will receive souvenir road rally warrior button featuring the Woodlands founder George Mitchell, and you need to sign up hopefully by February 7th. Again, that is happening on February 17th on a Saturday. You can go to the Montgomery County Historical Commission and find out more about that. Right now, Wait Until Dark is in their second week of their 3-week performances. And this is a classic thriller from 1967 that starred Audrey Hepburn as the blind woman, yet capable, that is burglarized by a trio of men in her apartment. And this is happening at the Owen Theater. So next Friday, Saturday, Sunday, and then the following Friday and Saturday, Sunday through February 11th. Go to owentheater.com. Stage Right of Texas at the Crichton Theater will be bringing back the classic of West Side Story. So many of you know that this is a 1961 American musical romantic drama featuring 2 different gangs. You have the Puerto Ricans gangs and the other gang that is the white kids, and it's all about love and a love triangle that's going on. And West Side Story, it is a musical. It will be a lot of fun. So go to crichtontheater.org to find out more about that. So if you're looking for venues for your next coming event, and this seems to be event season, January, February, March, April. So there's a couple of venues in downtown Conroe you might want to check into. You can contact 202 Main, Vintage Bar and Grill, or the Conroe Art League because they have unique facilities available. With that, we are going to take a quick break, and then we're going to come back with my first guest, and we're going to talk about breast cancer and how you can beat it or get assistance at MD Anderson.
Team Sinisi is a proud sponsor of Conroe Culture News. Vinny Sinisi and his professional team provide comprehensive real estate services throughout the greater Montgomery County area and beyond. Whether looking to buy, sell, or invest in real estate, Team Sinisi has an impeccable reputation. Contact Team Sinisi for a great experience at teamsinisi.com. That's TEAMSINISI.com.
Since 2004, Roger Stein Chiropractic has offered spine and joint manipulation services to residents of Montgomery County and surrounding areas. Conditions treated include lower back pain, migraines, headaches, whiplash, carpal tunnel, neck pain, sciatica, joint pain, sports injuries, herniated discs, and complications from pregnancy. Roger Stein Chiropractic, led by Dr. Stacy Rogers and Dr. Brian McGee, is an integrity-verified chiropractic clinic. Call 936-441-9990 for an appointment, or visit rogerssteinchiropractic.com. That's RODGERSSTEIN chiropractic.com.
And we are back for our first segment today. Sitting across the table from me, I have Dr. Matthew Wright. He's an oncologist with MD Anderson Cancer Center. And Kendra Windisch, she's the program manager, and she does a lot of outreach in the community to educate people about cancer treatments, prevention, a lot of prevention, because a lot of it is preventable, right?
Yes.
I mean, you could be aware of different things, right, and that way you can get on top of it. Early detection. Yeah. So, and you all have a Facebook page, MD Anderson. Of course, you can Google MD Anderson and get there right away and find out who you need to talk to. But right now, we're going to focus on breast cancer. So, Dr. Matthew Wright, how did you get into this?
Yeah, great question. So throughout my medical training, I really gravitated towards being interested in cancer and really connecting with the cancer patients through my rotations, did my training in medical school, residency, and so on. And also with a strong family history of different cancers in my family, seeing my family and loved ones be diagnosed and kind of see their journey. Some of them are survivors. Some of them did not survive.
It's personal.
It is very personal. And I really found my passion in treating breast cancer patients. And
good.
I love what I do, and they're really a special and great group of patients. And I'm happy to dedicate my career to helping to end breast cancer as we know it.
Wow. Okay. And you're located in the Woodlands, right?
That's correct. It's right on the border of the Woodlands and Conroe, right off 242.
All right. So when do you go see somebody? How do they get connected to an oncologist? How does this all work? explain that to me, the route.
So typically what happens is breast cancer is initially worked up by a primary care physician or a gynecologist. Typically what happens, one of them will find on either a mammogram or on exam, or sometimes a patient presents with a new breast finding or change in their breast. And further workup with imaging and subsequent biopsy will sometimes lead to the diagnosis of breast cancer. So by the time patients get appointments to see me and scheduled to see us, they already have a diagnosis from a biopsy-proven breast cancer.
And they're scared.
Very commonly, yes. Anytime anyone hears the word cancer, it's a normal reaction to feel scared, to have your mind race and to be unsure about the unknown and what does this mean with me, my health, my life, my family. A lot of questions can easily run through your mind.
Absolutely. Yeah. So to then backtrack, there are some prevention things, right, Kendra?
Right.
And what to look for and how to live life better and all of that, right?
So when do you go when you have some sign or symptom at home and you're like, do I go to the doctor? Do I wait for my next appointment? You know, there's that weird time where you're not sure what to do because you don't want to be that person that's overly, worried about things. But I tell people, you're whatever you're asking is not the dumbest question anyone has ever heard. Like it's never, when it comes to your health, you want to be overly cautious. Who cares if it's nothing? You want it to go in, you want to go in and have them say, oh, this is nothing. This is a normal breast change. But about 50% of all cancers are preventable. Like statistically. So that 50% that is preventable, then, we have, that's what I go out and teach, talk about maintaining a healthy diet, staying active, all these things that actually lower your risk for all cancers, including breast. And then, you want to go in and do your mammograms. Because I hear all the time, and you probably hear the same thing, I don't need my mammogram, Kendra. I don't have it in my family. And that's another statistic that I like to give people when I have a chance. I don't want to be a pest, but if it comes up in the conversation, only like 5 to 10% of cancers are hereditary. So 90%, that's a huge number, are not running in families. So just because it's not in your family doesn't mean you don't need to worry about it. If it does run in your family, you need to worry. If it doesn't run in your family, you need to worry. So you still need to do those yearly mammograms.
I was going to ask, okay,
know
so
your
those
body.
are annual till whenever?
Right,
I mean, forever?
Unless you
or
have,
what?
Yeah, well, yeah, until you and your doctor decide that it's
Correct.
not something you need to do anymore.
Correct. Usually until around age 75 or 80. Sometimes it can be sooner or later depending on sort of what other health problems a woman is facing. If her 10-year mortality estimate is if it's within 10 years, typically they don't recommend mammograms. But usually around age 75 or 80 is when we typically stop for an average risk patient.
Right. And my mother, I tell her, she was diagnosed and at 78. And it was just a regular yearly mammogram. And it was a simple 30-minute procedure taken care of. So easy. Because she was healthy enough to do it. Mm-hmm. And it would have been a very different story if she hadn't just been doing those regular tests. Yeah.
So what are some of the signs that you have breast cancer?
So there can be a number of different signs or symptoms you can notice. Often what I recommend and tell my patients is kind of have a good idea of what your baseline is, what your typical normal breast look like, feel like. If you notice any lumps, bumps in your breast, in your armpit, or around your collarbone area, if you notice there's any new skin changes to the breast that wasn't there before, any nipple changes, discoloration or nipple discharge, these are all things that could be signs that there may be a breast cancer there. Certainly, even if you've not been diagnosed with breast cancer, but you've noticed a change, my motto is, when in doubt, get it checked out.
Yes.
Best case scenario, it's nothing that's concerning and it's not breast cancer, but until you could have your breasts examined and possibly get some imaging done, till we know, is this something that looks suspicious for cancer or not? So those are what we typically see.
And a lump is what you hear most of the time. So when I'm out teaching a class about breast cancer, then we'll go into all of the changes. So there's the lump, and then that's sometimes
something
obvious.
That just feels off.
Right, and you're like, this wasn't here
when
before.
You're showering or whatever.
Right. And there's not a
okay.
specific exam that we talk about. We just tell people to know your body. So just like you were just saying. But sometimes one will swell, which sometimes is normal. So this is not to, upset anybody or get anybody worried. But sometimes one will swell. And sometimes the lump, too, you have to, not just on the breast, it can be in the armpit or up under the collarbone. There's breast tissue that runs, on different, it's in your breast, of course, but then kind of goes off to all the sides. So when you're checking, you need to check all the way around it as
How
well.
often should you check?
Monthly, I guess. Is that a good?
I
whenever
think,
you're in the shower.
Yeah, when you're in the shower.
Hopefully that's
no more than once.
More than once a week.
Once a month. Yeah, yeah. Because most people we found, and the reason we don't talk about MD Anderson, that self-exam like that used to be out there, is because with research we found people were finding it during their daily activities, showering, putting on lotion, something like that. It wasn't from, something that they did, every, on the shower card, I guess, that used to be out there that showed you how to do it.
There used to be a shower card. You would just hang in the shower.
Yeah, it's a good reminder, but that's not how most people were finding. It's sort of an accidental find.
Let's talk about dense breasts. So, how does someone know they have dense breasts? And that's through a mammogram, isn't it? Usually they tell you that, and then they do more of a 3D type thing, or?
Correct, exactly.
Am I talking of anything that makes sense?
Yes, no, absolutely, yes. So
you are.
I've been down that path. So.
Some women just naturally have dense breasts, and what that means is the tissue in their breasts is just more dense, and so there's more glands than there is fat. So for women who have these dense breasts, it can be harder to visualize the breast tissue and find a breast cancer. So that's why they sometimes get special types of mammograms to help better visualize that breast tissue. Now, it can happen in anyone to have dense breasts. It's certainly more common in our younger patients, those under 40 years old, those who are pregnant or who have recently been pregnant. But we certainly do see older women who can have dense breasts. And so sometimes we have to do special types of mammograms to help better visualize the breast tissue.
And those have become more advanced, it seems like, having done this for many years.
Definitely.
They used to always have to ask for a 3D mammogram, and now it's
kind of routine.
Standard.
I mean, I can't say it's fun, but
no, but it doesn't last very long.
It doesn't last very long, and generally you get somebody who knows what they're doing and are more adept to taking care of the person. Now, men get this too, don't they?
Yes.
Let's talk about that.
There's been a lot of that in the news lately.
Yes.
Yep.
Yeah, so men can get breast cancer. Men still have breast tissue. So certainly if men notice there's a lump, a bump, or something that's in their chest, breast that's different, definitely need to go see your primary care doctor, see your provider. They may need to do some additional imaging. Now, compared to women, men typically have much less breast tissue and are much less likely to get breast cancer, but they still can get it. That risk is not zero. In men who are diagnosed with breast cancer, they tend to have more hereditary breast cancer, meaning that they've inherited a gene, a mutation from one or both parents that put them at risk or made them susceptible to developing breast cancer. Certainly that gene can run in any family, so if any patient, man or female, has there's a relative who's a man that has breast cancer in their family, they should talk to their physician, talk to their primary care doctor. They may be eligible for genetic testing because they may be recommended to get some additional screenings if they're found to be higher risk.
And that's good for anyone, really, to get that genetic testing. If you think you might have something in your family, and really, it just makes you aware. Like, knowledge is power. We say that all the time. So, knowing that you have this in your family, you're probably going to make that appointment. You're not going to miss your mammogram, or you're going to get it earlier than somebody else, and then that genetic testing will let insurance know that you're eligible. That's a big thing too. So that instead of starting at 40, you may start at 35 or 30
earlier if you have
it in your family.
Questions and things. I love those reminders you get though too.
Yes.
From wherever your source is that you get your annual, they are good about sending reminders.
Right.
Like, oh crap, it's that time again. So it is it curable, breast cancer?
Yes, in general, breast cancer is actually one of the most curable cancers that we see. Not all breast cancers are curable. Once breast cancer is stage 4 or metastatic, meaning the breast cancer has spread to outside of the breast or nearby lymph nodes, when it's stage 4, it's treatable, but ultimately it's not curable. But earlier stages 0, 1, 2, and 3, yes, potentially curable, and we do cure a lot of our patients.
What kind of different procedures are there for that?
For treating breast cancer?
Yes.
Yeah, so a lot of our patients with breast cancer, basically if you want to be cured from breast cancer, you need to have breast surgery. So getting the tumor removed by a breast surgeon, we have really great ones at MD Anderson. And they work.
Is that what you do?
No, I'm not a surgeon. I'm a medical
Okay.
oncologist.
Okay.
So I'm the type of physician who treats breast cancer with medications, things like chemotherapy, other targeted therapies, or anti-hormone therapy to treat medically breast cancer cells. And then a lot of our patients will also meet a radiation oncologist. We have great ones also at MD Anderson. They use radiation therapy to treat breast cancer. So we all work together as a team. We have a different role to play, wear a different hat, but we attack and approach treating breast cancer from different angles to help give our patients the best chances for a cure.
It's personalized care depending on what's going on with that patient.
Absolutely.
Will you touch a little bit, because I get this question in the community a lot, because I think if you haven't had breast cancer or had a family member, then you just think there's breast cancer. But talk about how many different kinds there are.
Yeah, so there's
spectrum.
There's several different kinds of breast cancer, and it's categorized and classified in a lot of different ways. So as we were just discussing a minute ago, there's different stages of breast cancer that go from 0 to 4. Stage 0 is treated very differently than stage 3 or 4. And even regardless of the stage, there's different types of breast cancer based on what it's using to feed for the breast cancer cells to grow. So we look at what's called the receptor status. Now this is testing that's done on the biopsy when a patient's diagnosed with breast cancer. The pathologist, that's the physician who looks under the microscope that sees the breast cancer cells, they'll run some additional tests to determine what's the receptor status. Now these receptors, they're proteins that are on the surface of the breast cancer cell that when present or not, they give us more insight into how this tumor is likely to behave. And it also allows me to use medications to target those receptors that are positive. So we often categorize and classify breast cancer based on this receptor status.
And there's different medicines for each.
That's very
kind.
interesting.
Yes.
Yeah. So, and some are more aggressive than others. So that's, why some people it's, an easier treatment than sometimes others.
So is it declining or increasing? Which one is it right now with breast cancer?
Yeah, so I think it definitely appears to be increasing when you compare to the historical trends, historical rates. Definitely more women are getting mammograms than they were, 30 and 50 years ago. Certainly there was a bit of a pause during the height of the pandemic where a lot of patients, were not able to complete their mammograms, and we were seeing some cases diagnosed afterwards. But very common, unfortunately. 1 in 8 women are estimated to be diagnosed with breast cancer. It's the second most common cancer diagnosed in women in the U.S. I believe last year alone, just under 300,000 women or patients, individuals were diagnosed with breast cancer. In terms of all cancer cases, about 15% of all cancer cases in the U.S. Are breast cancer. And approximately 7% of all breast cancer deaths last year of all cancer deaths last year in the U.S. were from breast cancer. So very common, typically very curable, not always, but it is very common, and I'm sure we all just sitting here know not just one, but several between friends, family members who have experienced and been diagnosed with breast cancer.
Absolutely. And failure to get it treated when they were young, and the challenges that go on with that. So for the most part, it is curable if you get on it early. And the best thing is to be able to look at the previous years and compare, right?
Absolutely.
So you can see if there's any abnormalities from the previous year of what's going on.
That's correct. Early detection is key. The sooner we can catch the breast cancer in an earlier stage, the more likely we're going to be able to cure it. So that's why getting your routine mammograms, getting those every year, making sure that we're keeping a close eye and monitoring that if there is something that develops, we can catch it early on and not later stage where it's a very large tumor where it's already had plenty of time to spread to lymph nodes and other areas.
So what is the answer when women say they don't have insurance or can't get it done?
There are lots of community programs for that, and we have a list. I did not bring that. I should have done that. So yeah, we can.
The Rose
the
does
Rose,
it,
and there's places like the Rose, and then MD
There's
Anderson
others,
also has a program as well that will help.
indigent?
Yes,
or
and
people that
it's
can't do
places like, it's the FQHCs, like Lone Star Family Health Center, and there's some others in the area. And we have the mobile mammography bus that will come out and do, like, similar to what the Rose does. And then there's also the clinics, like Lone Star Family Health Center.
So there's
connect
answers.
with someone,
You
yes.
should still get it
or
done.
Montgomery County Hospital District, they will help
Yeah,
as
that's
well.
true
So
as well.
you just have to reach out to your county assistance programs and
see
or
what
us. I mean, we
work.
can also at least, guide you. And if you are diagnosed, MD Anderson has a program that if you qualify for, can be treated at MD Anderson.
And you have the facility that's local here to
Yes.
Montgomery County. So you do not necessarily have to go downtown Houston to the medical district.
And for
correct.
surgery,
But you could.
right? Right. You
Yes.
might have to.
Yeah.
But we now have a surgery center in the Vintage Park area. So not all surgeries, they were all having to go down to the med center. So now they can stay a little bit closer.
And MD Anderson is the #1 place to go in the world, isn't it?
We're biased, but yes.
I mean,
it is. It is.
That's where I would go. Sometimes I ask my husband just random questions, like, okay, so if I got cancer, where would we go? He goes, well, you go to MD Anderson. So,
Right.
yes, very well known.
And we do have routine mammograms, which we didn't mention. I think a lot of people assume they need to be diagnosed before they come, but up here in the Woodlands now, if just for your regular yearly screening
You do that?
mammogram, you can come to the Woodlands. We have weekday and Saturday appointments.
Schedule it,
and
go online,
right, and
whatever.
and anyone can come, but a lot of people that have a family history or they have a personal history of some issues, some close calls or some scares, they really want someone with the really specialized training to
Sure.
read their mammogram, so
Yeah.
they'll come over to us. Of course, you have to check insurance and
I was going to say,
all
you
of that
take
good stuff. We
insurance and
do,
all
right,
those
so it
things.
depends on that, and sometimes we're all, a slave to our insurance and where it tells us we can go, but we will check all that ahead of time. And so if it is an option right there on 242 if people want to do that.
Very good. What have I not covered?
Any other? I'm trying to think of some things I hear. One thing that's we know more and more about. And it's probably, I would say, and you can maybe correct me if I'm wrong on this. About the last 10 years, there is a lot of research on alcohol consumption and breast cancer, and there's a link there. And maintaining a healthy weight, we talk about a lot. But also, I always like to throw that in about the alcohol consumption. So for cancer prevention, if you're really worried about it, it's best not to have any. If you have breast cancer in your family and it's something you're really trying to stay away from. If you do, then the recommendation is 1 drink per day for women and 2 for men.
That seems like a lot, 1 drink per day.
Right. And and they'll always ask me, and we get a
don't
good
know.
laugh, can we save them all up for Saturday? I'm like, no, it doesn't help. Because your body gets rid of things.
I
Your
don't drink
liver
1
and your
drink per
kidneys
day.
and your right. I know. Your body filters what it doesn't want, right? But if you give it 7 on Saturday, if it can't get rid of it, it stores it, and then down the road.
If it was habitual,
It's a
I can
problem.
see
Yes.
that being a problem.
Yes, it's not 1 weekend. I don't want. If you had a bad weekend, don't panic. But it's cumulative over your
Moderation,
lifetime.
moderation.
Yes, 100%
Just keep
moderation.
moderation.
Yeah.
Absolutely.
But
So
there's
you're-
a tie there, and I
okay.
want people to know that.
So alcohol,
Absolutely.
and eating right, and leafy
Stay
greens,
active.
and
And it's not just cancer. all
exercise,
those things
walk,
help you with.
just
It's
whatever. Just
heart disease,
maintain,
diabetes, right?
maintain a healthy lifestyle.
Yes. Yep.
Choose your friends.
Stress. I
Yeah.
mean, there's a tie with stress.
Take a
it's,
break from work.
sleep.
Walk away from the desk.
Yeah. Go outside and get
All
some.
good stuff.
Yeah.
Avoid drama. Just saying.
That's a whole nother show.
That's another show. But you're available also to keep educating people.
Yes, and the
all the
website
time.
you mentioned, so all these topics, sunscreen, breast cancer, any specific cancer, diet, exercise, all of those, if you go to mdanderson.org and just type what you want to know in the search bar, it will come up. And if you need information like these cards that are sitting in front of us for your clinic or
good
for your
information.
church, you tell us how many you want, we ship them to you for free. You just have to ask. So get in there. If you have a group of people where you could put these out in front of them, we're happy to send them to you. Or if you want me to come out, I will come and do a class.
And you've done those before.
You've probably heard a lot about.
A lot of it. So,
You were always there.
I try to be. Well, thank you both very much. I think this is a good topic that people need to talk about, but they often don't. There's so many of those things. And, you're both very good at what you do, and sharing that on this show. I appreciate that. And I look forward to seeing you again for not breast cancer, but
Not in the clinic.
but in the community.
Yes.
Thank you.
Thank you
Thank
for having
you.
us.
All right.
Since 2004, Roger Stein Chiropractic has offered spine and joint manipulation services to residents of Montgomery County and surrounding areas. Conditions treated include lower back pain, migraines, headaches, whiplash, carpal tunnel, neck pain, sciatica, joint pain, sports injuries, herniated discs, and complications from pregnancy. Roger Stein Chiropractic, led by Dr. Stacy Rogers and Dr. Brian McGee, is an integrity-verified chiropractic clinic. Call 936-441-9990 for an appointment, or visit rogerssteinchiropractic.com. That's RODGERSSTEIN chiropractic.com.
Team Sinisi is a proud sponsor of Conroe Culture News. Vinny Sinisi and his professional team provide comprehensive real estate services throughout the greater Montgomery County area and beyond. Whether looking to buy, sell, or invest in real estate, Team Sinisi has an impeccable reputation. Contact Team Sinisi for a great experience at teamsinisi.com. That's TEAMSINISI.com.
A Lone Star Community Radio is looking for those who are interested in hosting their own talk show, with monthly and weekly slots available on Conroe's FM 104.5, 106.1, and on irlonestar.com. Start your own podcast, create your first YouTube channel, and be on TV. Contact Lone Star Community Radio online at irlonestar.com or call the station message line at 936-647-3776 to take your first step into the radio world.
Does volunteering at a nonprofit horse sanctuary sound wonderful? Or are you a veteran or a veteran spouse and think trying a peer group session through a local Horses and Heroes equine program might be worth trying? Henry's Home Horse and Human Sanctuary, located in Grand Central Park by appointment only, is home to a growing number of rescued and donated horses. Visit our website at henryshomehorsesanctuary.org or check out our Facebook at Henry's Home Horse and Human Sanctuary for more information.
Every Friday, tune into Texas Ticket on Conroe's 104.5 and 106.1 FM with Armando Nino of Gold Lake Conroe, focusing on Montgomery County area events and places. Get a feel of the Texas spirit at the event, paired with guest and vendor interviews, event coverage, and ticket giveaways, and so much more. Join us Fridays and punch your Texas ticket. For more information on the show, visit irlonestar.com/Texas Ticket.
Our talk shows and music shows are looking for sponsors. Want to expand your brand awareness? Reach the hyper-local audience in Montgomery County? Lone Star Community Radio sponsorships accomplish this. Want to see our stats and rates? Check out irlonestar.com/sponsor for more information. Or call in and leave us a message at 936-647-3776 with your question. Get seen on TV or YouTube and heard on our podcast, FM, and internet radio. Sponsor your local radio station with Lone Star Community Radio.
Hello, we are back with our second segment today, and we're going to talk about the fundraiser for LeAnn Mae. LeAnn Mae is sitting across the table from me, and she is accompanied by Don Walsh, who's apparently her promoter for the fundraiser. We're going to talk about why you're having a fundraiser And, this whole show is all about medical stuff, so it has a good connection with everything. We just spoke about breast cancer. Now we're going to talk about kidney donations, right? So tell me what the story. Give me some background on this.
Okay, so my friend Shelby, she has a very rare disease. It's called like Wagner's or something. And she's been sick since we were 15 years old, and we're 31.
Wow.
And she had gotten COVID 2 times, and it attacked her kidney. So she's been on dialysis for about 2.5 years. And so her mother had the same blood type, and she got tested, and she's not a match. And then I found out my blood type, so I decided I wanted to go get tested. And I told myself, if I'm a match, I'm just going to give her my kidney. And so I went, and I ended up being a perfect match.
Wow.
So
well, you can't exist with one kidney.
Yes, ma'am.
And a lot of people do that, and that's very honorable for you to do that. And I bet she was super excited. I bet you had a big reunion about that.
Oh, yes. She's very excited, and so am I.
So tell me about Shelby.
Shelby, we've been friends since we were 14, 15.
She live out here in the community?
Yes, ma'am. She just moved to Huntsville. Her and her husband just got a house.
Mm-hmm.
We cheered together for 6 years. She's a very outgoing woman.
Did you guys grow up here in this community?
In Conroe, yes, ma'am.
In Conroe? Did you go to high school
Yes,
out
ma'am.
here?
I went to Kenny Creek together.
Okay.
So she's been married for a few years, and they've been wanting to have a child, which there's complications because of the kidney.
Sure.
So they're looking forward to that.
So, are you scared?
Not really.
No? You're ready?
I've prayed about it, and I have a lot of peace about it.
And you have a daughter yourself?
Yes, ma'am.
9 years old? What's her name?
Natalie.
Natalie. So what does she think about all this?
She's just all nonchalant about it.
Okay, let's go,
So,
right?
Yeah.
And you have your own salon.
Yes, ma'am.
That's why you have beautiful hair.
Thank you.
And that salon is called Bella Mia?
Yes, ma'am.
Salon, where is that located?
So it's in Conroe off 1314, between 242 and Crichton.
Okay. I know whereabouts that is. What is your specialty?
I specialize in hair extensions and for sure blonding. I've been known for blonding for a while. So
As you can
that's
see,
my favorite.
I'm an example of.
Oh, yeah.
Okay. Mine's just natural.
Yours is very pretty.
Thank you. So you're gonna get this done on what is the date?
February 12th.
February 12th. That's coming up.
Yes, ma'am.
And how long will you be in the hospital?
My surgeon says he'll try to get me out in a day, but at the most 2 days. He says I'll be very angry whenever I leave, uncomfortable.
So you'll be out of work for a period of time?
It's about a 6 to 8 week healing process. I can't work for that amount of time. So.
Do you have people that can help run your business?
So I've been the full operator of my business for years now, and I just hired on a new stylist who's gonna help take care of some clients in the meantime, but most of my revenue comes from my clients that I have.
Your own. So you're basically the person who runs
Yes, ma'am.
the salon. All right, so you're having a fundraiser coming up on February 12th at Sawyer Park. Ice
4th.
House.
Sorry.
February 4th. The surgery is the 12th. So you're having the fundraiser before the surgery
The
because
Sunday.
you want to be present, you want to be there, and you're going to be feeling and you don't want to get out. That makes
Right.
perfect sense. So that's this Saturday at Sawyer Park Ice House from 1 to 6 p.m. All right, Mr. Details.
Yes,
So-
that would be me.
Yes.
I've had worse nicknames. So this will be Sunday, just to clarify.
Sunday.
Yep, Sunday, February 4th at Sawyer Park in Spring. Have you ever been there?
Yes.
Yeah, it's a great spot. And so they've been very kind to host this for us.
It's
and
a beautiful venue.
It really is. And so if anybody's not been there before, it's at 314 Pruitt Road in Spring.
Mm-hmm.
You want me to run through it real quick?
Absolutely.
All right. So we're going to have live music, a raffle, silent auction, and live auction. And the show's schedule is we're going from 1 to 6, as you said. From 1:15 to 2:15 p.m., we're going to have Blake Harlow, Tyler Hodgson, and Orion Burrows on stage. And then from 2:30 to 3:30, we're going to have Brian Sacco, Caleb Holscher, and Nate Nelson on stage performing together. Then we're going to take a break from 3:45 to 4:30. We're going to do the live auction at that time. And then just remind everybody that the raffle is going to end about 5 o'clock. And then the silent auction will end about 5:30 so that we can get all the raffle tickets and things together and find our winner. From 4:30 to 5:30, we're going to have John Loring, Bronco Jr., Mandy Powell, and Heather Raylene. And then we're going to stop and take a break from 5:30 to about 5:45 and just announce the silent auction has ended and also announce our raffle winner. So from 5:45 to 6, we're going to continue on with John Loring, Bronco Jr., Mandy Powell, Heather Raylene, and maybe LeAnn Mae. Maybe get LeAnn Mae on stage because she has a wonderful voice, so we'll see if we can get her up there. Yeah. And if you like barbecue, Sawyer Park Ice House has been kind enough to donate their barbecue plates, 50% of their barbecue plate sales to LeAnn's fundraiser. So if you like a grub on barbecue, order a $15 barbecue plate when you're there on Sunday, and 50% of the proceeds will go to LeAnn's fundraiser. We'll also have QR codes on the tables for silent auctions so that you can donate directly to her if you'd like to do that with a Cash App and I think Venmo, right?
Yes.
2 different apps, yeah.
Wow, it's a big event.
It's a big event. So as you can see, there's a little bit of something for everybody when it comes to participating. So there's multiple ways that they can help. We're also going to have some fun things going on. So we're going to have a photo booth set up, which is thanks to Crystal Butler at KB Creative Events in Spring. So you can take silly pictures, fun pictures at this photo booth, and it all gets downloaded, and you'll get a link to your cell phone so you can have your pictures, but also they're going to have all this available for LeAnn so that as she's healing, she can look back at all the silly pictures of everybody and enjoy them as she's resting. And then we're also going to have, and you don't even know about this yet, but we're going to have face painting because this is kid friendly. So we're going to see.
Exciting.
I know. Breaking news. So we're going to. I think I will too, actually. So we're going to have face painting for kids or anybody from 2 to 4 p.m. And people have asked if we can give a hint on some auction items. They've asked that several times. So we're going to give that on your show. We haven't told anybody this stuff yet, right? So there's an acoustic guitar that's wrapped and autographed by country music artists Jesse Robb Jr. and Jake Bush. So that's going to be one of the live auction items. There's a helmet autographed by NFL Hall of Famer, former Kansas City Chief Tony Gonzalez. So now that the Chiefs are going to the Super Bowl the week after this, it's perfect timing for that. We also have custom painting from a renowned artist and good friend of mine, speed painter Tom Verano. So if you're not familiar with Tom Verano, he's a Christian motivational speaker as well. So he visits schools and talks to kids about inspirational things in their life and paints at the same time. His mantra is reaching the heart while creating art. So if people want to see the level of art that he provides, you can go to emotionintoart.com. That's emotionintoart.com and see the level of quality he brings so that you can bid on several paintings of his, and he'll make them custom for them for whoever wins. Another painting is from a local artist and close friend of LeAnn's, Nikki Porter. So we're excited to have a painting from Nikki available. Also, Boots for Troops. You know, Lindsay and Jimmy Rogers from Boots for Troops. They were kind enough to donate a VIP experience to their Peel for a Purpose Crawfish Festival on April 13th at Sam Houston Race Park. And the bands, just a few of the bands that are going to be there is Carlton Anderson, Rick Trevino, Brian Martin, and Sawyer Brown. And I'm a huge Sawyer Brown fan, so that's going to be a great event for folks. We have signed and framed jerseys that'll be available. I can't say who that's going to be yet. So that's a secret. A spa package from LeAnn's very own Bellamia Salon will be available.
And a hair package.
And a hair package. And then a multitude of other wonderful items, including more concert tickets, event tickets, gift baskets, massage gift certificates. We even have a tattoo gift certificate.
I might get a second one too.
So we got all kinds of stuff going on, and tons of amazing movie and sports memorabilia too, because we're going to have our auctioneer there providing some of these items. So it's going to be really, really exciting.
Wow!
And
a lot of community.
Huge.
Engagement.
Community's really stepped up,
great.
including Barsh Auto Services, and they're going to provide, and correct me if I'm wrong, but it's a free oil change for everyone that wins an item during the live auction.
That buys one.
Yeah, that wins the live auction item. So that's really cool. Can I give a shout out to some of our sponsors real quick?
Of course.
So we've got obviously Sawyer Park Ice House, who's been tremendous help, and that's Todd Weaver, who's one of the owners, Chantel Sherman, Maddie Ratliff, Kevin Rutledge, and Brian Butler. They've been huge in helping coordinate this over the last couple of months, and it's been a real blessing for them to host this for us. Charlie Diggs Entertainment and Promotions. Charlie's been a huge help getting all the musicians together for us who are donating their time. Again, Barsh Auto Service and Buster Barsh, KB Creative with Crystal Butler. R.D. Floyd created our event posters. And then Ben Blankenship has been a big help as well. And then, of course, all the musicians are a blessing for them to donate their time. Last couple things I just want to throw in there.
That's a big deal because you have a lot of musicians.
Oh,
right?
my gosh.
How many bands do you have?
They're not bands. It's individual
Musicians.
artists.
Yeah. How many do you have?
Oh, you're going to make me do my math now.
3, there's 6, 10.
That's a lot.
We got more than that. It's, 3.
You said Caleb that used to be with the Tomatoes?
Yeah, they just played the other day. Yeah.
Okay.
Yeah, yeah.
Okay.
Caleb Holscher?
Yes. Yeah, he's great.
Yes, he is. He's a good friend of mine.
Yeah. So if anybody has any other items they want to donate, they're more than welcome to do so. Sawyer Park has been kind enough to allow us to have them dropped off there this week. We'd like to have them by Friday so we can kind of get an idea of what we're going to, have. But yeah, that's about what we got. But right now there is a Facebook event page that's public, so people can go to LeAnn Mae Fundraiser and follow us there.
And that's on our page as well. So that's good.
And I believe there's 110 people so far that say they're going just through the event page alone.
And 300 interested.
Yeah.
So about 400.
So like you said, the community has really stepped up, and
That's fabulous.
it's amazing.
It really is.
I feel very blessed, for sure.
And Sunday is a good day because there's not a lot.
There's no football.
It's the only Sunday with no football lately.
Wow.
The
Like
Sunday
you had a
before
plan
Super
or
Bowl.
something.
Weird.
Yeah.
You know me.
I told my clients, I was like, so your husbands have no excuses.
Oh, that's great.
And-
I love their outdoor area there.
Yeah.
It's very nice.
Yeah, and it is kid friendly again. So when you get done with church on Sunday, you can all head right over.
Yeah, I have my daughter there.
Wow.
You should come.
I have 2 events I have to go to that day, but we'll see.
Okay.
Yeah.
It's going to be a blast.
Yeah. No, it sounds like it is. So how did you two connect? By just the salon or what?
I found her dog. It's a true story. So her dog was missing, and I saw the post on social media, and I think it actually said it was your daughter's dog.
Well, I posted a picture, so yeah, she loves him. So
Yeah,
definitely.
so
We'll bring him back if somebody.
What's his name?
Nico. He's a husky, and he likes to escape
Yeah, he's
a
an
lot
escape artist.
and dig.
So
you all live near each other in
yeah,
the community?
right. So I saw the
Okay.
neighborhood was near mine, and I went driving looking for it. Didn't find
Wow.
it. Was
You went
gonna.
out looking for the dog.
Well, I figured I was on my way to the gym. I'd take a look while I was going through the neighborhood. Didn't see it, and then there's a park, a large park that's in between our neighborhoods, and I thought I'd been missing for 3 days. There's no way the dog is in there. But something told me to hang a hard left, and I did. And then I saw a guy walking 2 huskies on leashes, and I'm like, I don't know why I felt led to stop and ask him if he'd seen a dog, but I did. And he said, yeah, this one 3 days ago. It's not mine. I found it here.
How weird.
So that's
and he had
that's
no social media either.
right. And the dog wasn't chipped, so he had no way to find her. So yeah.
Huh.
So I just
Isn't that
happened
crazy?
That was meant to
to drive
happen.
up on right. Crazy. That's how we met. We're friends ever since.
Wow.
Yeah.
Well, I met you on a bus ride.
Yes, you did. Yeah, to the Capitol.
February 14th. I remember that.
Yeah.
That's awesome.
Yeah.
Last year. Yeah.
That's pretty cool.
Yeah.
Yeah. So you meet people in strange ways, huh?
Mm-hmm.
Yeah, just
And then
lose
you're
a dog
connected.
and you meet somebody really
No,
cool.
that's a fabulous story. I love dogs.
Yeah. Well, and then when she
So-
started sharing her story with me about the kidney donation and everything, you could just see what a wonderful person she is. And she's really amazing. I mean, people need to come meet her, and get to know her because she is truly one of a kind. And I think they'll see that during the event as well.
Well, it's a huge endeavor, and I don't really know what's involved in giving a kidney away. I have never actually met someone who's done that. But it sounds like it's a big procedure, and hopefully it will be a good match for her, and it will help prolong her life and, make her feel
Yeah.
a lot better.
Yes, ma'am. Yeah,
So-
I definitely, the more prayers, the better. But her doctor said she'll be in full remission when she gets a kidney from her disease.
Wow.
Because there's not a cure for it. And then she'll be able to have kids, and she'll be off dialysis.
So you all will be connected forever.
Yep, exactly.
That's
She
a major
can't get away
deal.
from me.
So not only, how long have you all known each other?
We're about 14 years old.
Wow. Well, it's good. It's interesting how you stay connected with certain people,
Yeah,
and you can be there truly for them,
right. God will put you in each other's life.
Mm-hmm.
So
purposely.
15 plus years later, you end up being a match for their kidney.
Wow.
It's pretty amazing.
Well, I'm sure
excited.
your daughter will remember this event, and it will make a difference in her life, too.
Right.
Of what her mom did.
I definitely want to show selflessness and, just the way that, we should be. We care about other people, so if we could help somebody.
That's what we're called to do, is help others using whatever we got.
Right.
Absolutely. Okay. Anything else you want to add, either of you?
Yeah, I want to thank everybody that's helping. So it's very touching, and it's very emotional. So
it is.
It's a big thing.
It's personal.
So I just didn't realize how many people would be so involved.
Are there risks involved with this with you?
The only thing that would be a risk is if I want to have more kids, which I do. So I'd be a high risk pregnancy, but it can be managed, so it'll still be okay.
So that didn't stop you?
No.
Well, God be with you, the both of you. And it's a big endeavor. I wish you well, and I will make an effort to come out there and see, or at least share this, which is what I will do.
Thank you.
And I hope people are listening and show up. Well, thank y'all very much. And the show is sponsored by Roger Stein Chiropractic and the Lake Conroe Realty Group. Had a great show today, and appreciate y'all coming on.
Thank you for having us.
Don't forget to download the Lone Star Community